When it comes to ejaculation, we don't have that much in the way of direct control. Ejaculation is an autonomic nervous system thing. That word autonomic, that means automatic. If you've ever tried to delay your ejaculation when you're close, maybe now and again you might have tried that, you've battled with your autonomic nervous system and you know how frustrating that is. Now, one thing you do have is your breath. A direct way of calming your nervous system, slowing down the reflex. But as a therapist, I say this to guys and they're like, no, I've tried that. I've tried breathing slowly during sex. I've tried holding my breath. It doesn't make any difference. We do need a bit of technique here to get the delaying effect, that's true. Wim Hof breathing for delaying your ejaculation? No. The Buteyko breathing technique does get talked up as a cure for premature ejaculation because of its relaxing effect and its effect on our nitric oxide levels. Clinical studies have found that men with lifelong PE tend to have lower levels of nitric oxide in their blood compared to men who don't struggle in the endurance department. That's interesting. Buteyko has been around for decades. It puts emphasis on nasal breathing and breath holding, aka the control pause. Buteyko teachers say both of these raise nitric oxide levels. So men are making this connection. I did a quick Google and there are articles and posts on premature ejaculation forums saying that when you get close to coming, do a full exhale and then hold your breath for 8 seconds or longer. Research also found that men who took SSRI medication as a treatment for PE, they lasted longer and their nitric oxide levels measured higher. So there's correlation here when serotonin levels are raised and other complex neurological processes are affected and you last longer, raised nitric oxide levels are a marker of this. Serotonin does affect ejaculation, no doubt about that. And it interacts with nitric oxide. But does this work the other way around? Probably not. For helping with early ejaculation and performance anxiety and stress and racing thoughts and pressure and all the things that speed us up, I'd suggest other breathing techniques like the physiological sigh and simple 7-11 breathing. Now with the physiological sigh, you take a breath in, followed by a top-up breath, and then a big exhale, relaxing all the way down. See Andrew Huberman's video on that. 7-11 breathing is taking an in-breath for a gentle count of 7 and then exhaling for, would you guess, a count of 11. And you can do these things as a regular practice to really get the benefit. And you can do them during sex with your partner. Just don't wait until the point of no return. Breathe sooner when you notice that you're going up through the gears. Big breaths are a better look in bed too than breath holding, in my opinion. Techniques that incorporate a long, slower exhale, which helps engage the parasympathetic nervous system, which definitely plays a role in ejaculation, but they don't require a breath hold. And there's plenty more. You could look into box breathing, belly breathing, etc. Wim Hof breathing, that tends to engage the sympathetic nervous system, and it has the opposite effect. Brilliant for running up mountains naked, etc., but not so great for relaxing into sexual intercourse. Now, I have some other videos with evidence-based suggestions about breathing exercises and techniques for overcoming PE, and I cover this on my self-help training course in some depth. I hope this has been informative. Buteyko didn't turn out to be the cure for PE, but don't write off breathing. There's plenty you can do, therapeutically proven things to reach your full sexual potential. Thank you for watching.